Hi, I'm Dr. Julie Marmon. I thought we'd talk a little bit about headaches today. Headaches are a huge topic, and we are not going to go into many details here. But what we are going to talk about is when you need to be seen for them, when you should be seen rapidly, when you should be worried, and maybe some tricks and tips at home that might help you feel better. So when we look at headaches, there are probably hundreds of things that cause headaches. What we see typically in the emergency room or at the urgency center are migraine headaches, cluster headaches, tension headaches, and sinus headaches. We did talk a little bit about sinusitis in another video, so if you have questions about how to treat that, I'm going to refer you back to that video on our YouTube channel. But let's talk about migraine headaches, let's talk about pain relief, and let's talk about, more importantly, really bad things associated with headaches that make us worry and would be a reason that you should probably be seen sooner rather than later. So let's start there. If you have a headache that you've never had before, it's persistent, it won't go away, regardless of Tylenol, Motrin, anything you're taking over the counter, you should probably be seen. If you have a headache that comes on suddenly out of the blue, that feels almost like somebody hit you with a baseball bat, you should be seen immediately. If you have a headache associated with a fever, that's a reason for concern, especially if it's associated with a stiff neck, or if you notice a funny, really red rash. Those are reasons for immediate care. Don't think about it, just seek care, and let's make sure you don't have some severe things. In the emergency world, the things we worry about and the reasons we recommend that for those things, the sudden onset, the headache with fever, or the headache with a weird rash and fever, the reason we recommend that you be seen for those is they're life-threatening emergencies. They can indicate bleeding in your head. They can indicate meningitis. So big, bad problems. And as emergency physicians, that's what we're always looking for. We're always trying to make sure that you don't have something awful with your headache. So if you don't have any of those things, and you have this headache that just won't go away, what do? Well, if you can't get into your primary care physician, and it's just lingering and lingering, or it's so severe that you're having nausea and vomiting with it, and you can't tolerate any fluids and you feel like you're getting dehydrated, those are other reasons to seek care immediately. So when we see headaches in the urgency center and we take a look at you, we examine you, we listen to your history, and we say, these aren't really those big, bad, awful things like a bleed in your head or an infection. How do we get you better? Every doctor has their way of treating headaches. In the emergency room, we tend to use IV fluids. We use medications. There's several classes of medications that we use. Often they're the medications that help you stop vomiting, which is great because they get rid of the headache. And for people who have nausea and vomiting with their headaches, we can resolve that. And then we'll get you some pain medication. Now, if you talk to neurologists and most people, they will all agree that most people in the headache world, I shouldn't leave it just at most people, they'll all agree that narcotics are not recommended for the treatment of headaches. We use a lot of different classes of medications, but typically stay away from the narcotic pain medications as they're not a good long-term fix, and certainly not a fix for chronic headache pain. So once we get rid of your headaches, do we need to do further workup? Well, we do recommend that if this is a new headache, you've never had a headache before, or if you have headaches and this is something that's completely different from your normal headache syndrome, we'll talk about imaging with a CAT scan. So we have one of those at the urgency center, and we'll take a quick look at your brain and make sure that we don't see anything unusual. We look for tumors, we look for bleeds, we look for anything unusual in the architecture of the brain. And we work with some great radiologists who are able to do that. Once we get your headache under control, once we've done any imaging or lab tests that we need to do, we'll often, if this is a chronic headache, recommend that you see a neurologist. Neurologists do a variety of things, but they also are headache specialists. They're fabulous at what they do, and we have plenty that we refer to. So if you have any of those bad symptoms associated with a headache, remember that's the sudden onset headache that feels like somebody hit you with a baseball bat. You have any neurologic changes, that's a big one that I didn't mention previously. If you can't walk, you can't talk, you call 911. Or if you have fevers and a stiff neck or a rash, you should absolutely be seen immediately. If you have any questions, you can leave us a message in the comments on Facebook if that's where you're watching this, or for more information, give us a call.